Well, vaccines are also a hot topic in Florida right now following an announcement from the state's Surgeon General.
The Florida Department of Health, in partnership with the governor, is going to be working to end all vaccine mandates in Florida law. All of them. All of them.
This would include the vaccine mandates for kids attending Florida public schools. All 50 states have at least some vaccination requirements for children entering school, though all allow for medical exemptions and most allow exemptions for religious or personal reasons. The move is a significant departure from decades of public policy. So for more on vaccines, we'd like to bring in Dr. John Brehany. He is the Executive Vice President and Director of Institutional Relations at the National Catholic Bioethics Center. Dr. Brehany, first, why do we have vaccine in the mandates? And to be clear, we're also talking about childhood vaccines like polio, measles, etc., correct?
That's true. And it's interesting. The United States has had vaccine mandates, various states, of course, going back to the later 1800s. And they've expanded all through the course of the 20th century. Based on the belief that they protect the public health. I think a lot of people have sincerely believed that, and that's why we have these mandates.
What is the necessary baseline, in your opinion, of vaccines to avoid some kind of pandemic again?
Well, with all of these things, we're talking about multiple diseases, multiple vaccine products. Yeah, it's huge. It's very hard to respond to that specifically. If I could just make one point, though, I see there's a lot of outrage about Florida, and it sounds almost unprecedented. However, I know the country of Denmark has no vaccine mandates to attend public schools in Denmark. Now, they also have very high vaccine acceptance and utilization rates. But, and I think other European countries have fewer school mandates than the United States. So, in principle, this is a matter of prudence. And already states mandate different vaccines at different times. There's actually a fair amount of diversity out there. There's not a one-size-fits-all, even across all 50 states.
Of course, certainly this is a very interesting development, to say the least. But what are some of the newest vaccines that are mandated? Can you tell me about those?
Well, of course, the newest one that was mandated in different ways by federal agencies was the COVID-19 vaccine that was added to the childhood schedule in some states. And the American Academy of Pediatrics is still recommending it for children as young as 6 months old. That's probably the most recent vaccine. I think a vaccine for RSV, that the respiratory syntactical virus, is a more recent one, let's say, than polio or smallpox or something like that.
We also understand that potentially the COVID vaccine could be restricted now to older Americans or those with a special condition. How do you suppose that might affect illnesses this fall?
Well, and I'm a doctor of philosophy and not a medical doctor, so I couldn't be specific. However, I would just note again, this is very interesting. Other European nations they have been restricting the COVID vaccines in a very similar way to the oldest among their populations. I think it's Sweden and the United Kingdom, to people 75 years old and above, and to people with specific health risks. So some of the restrictions that I've heard that Secretary Kennedy has been supporting are actually underway in other European countries right now. The mRNA vaccines, some people think they were quite effective, but many people believe they were not that effective, is certainly in stopping the transmission of coronavirus, or SARS-CoV-2. So it's really hard to say, but I think some of the changes that we're hearing out of Senator Kennedy and HHS are actually public policy in other countries. They're not that different.
Yeah, certainly people will be taking a look at those, and definitely a very interesting development that all eyes will be on in Florida. Dr. John Brehany, thank you so much. We appreciate you.
Absolutely.